illness are a vulnerable group as a result of the way they're subjected to stigma and discrimination, restricted access to mental health services, and as a result are living with disability. Many of these people live in poverty, are homeless, and have overall poor physical health. Who are these people? According to the Office of Disease Prevention and Health Promotion, mental illness includes a set of health conditions that are characterized by alterations in mood, thinking, and/or behavior that are associated with distress and/or impaired functioning. Mental disorders also are among the most common causes of disability. An example of some of these conditions include depression, anxiety, bipolar disorder, schizophrenia, personality disorders, and PTSD. There are a few main barriers creating a gap to health improvements. The access to mental health services is an issue for these individuals. There is a lack of mental health services in primary care and also emergency services. Many inpatient mental health facilities have closed their doors due to a lack of funding, creating additional barriers for these people. Not only are the options limited, but the ability for this population to receive their services may be restricted, whether this is due to transportation, location, or economic reasons. Another big issue for mental health patients is discrimination. A systematic review done by Mesdahl and Hansen in 2014 concluded that despite recent efforts in community treatment, patients with schizophrenia still experience stigma and discrimination. It's community healthcare professionals' role to raise awareness in order to increase their clients' acceptance in society. This discrimination included that of the healthcare workers. Patients reported feeling that they are not taken seriously and feel discriminated in a sense that they are denied access to a normal provider-patient relationship. With this being said, these patients hold a lack of trust in our healthcare system and are less likely to seek care, leading to an increase in their vulnerability and a decrease in their physical well-being. A study performed by Susan Vanden Tiller, Donna Kurtz, and Penny Cash quote a mental health patient, Priscilla. "I have less and less faith in the healthcare system and healthcare politics. You learn to do a lot on your own with little information. They don't tell you very much. They don't tell you why you have to take your meds or how they work, or they think little information is going to help." She goes on to say her provider would make derogatory statements and never believe what she would have to say or take her concerns seriously. Well, how can we improve health literacy among this population? First, start with respect. The mentally ill often experience discrimination, shame, and embarrassment. Welcoming them as patients that have the capacity to learn enables improved participation, relationship building, and therefore improved outcomes. Second, according to the World Health Organization, mental health services should be included into all primary level care and emergency services to improve access. To decrease the men and women with mental illness living in poverty or are homeless, employment and income generating opportunities must be created and their human rights protected with their inclusion in the development of policies and laws. Healthy People 2010 and 2020 have included multiple goals regarding the well-being of persons living with mental illness. Some of these improvements from 2010 include homeless adults with mental health problems receiving mental health services have increased to 50%, exceeding the target goal. Primary care facilities that provide mental health services has also increased over the target goal. But still many of these targets were not met, and although improvements have been made, there's still much work to do for 2020.